In other news, a security guard accused of shooting dead 14-year-old Jevano Siegel during the Mangaung protests on Monday has been granted bail of 1,000 rand. The case has been postponed to the 9th of June, where the state says it wants more time to investigate. The guard is charged with culpable homicide. Meanwhile, service delivery protests in the area are continuing. Well, there had been an announcement earlier of a postponement or a pause in the demonstration. A group calling itself the Mangaung Community Concern is calling for the disbandment of the Metro Council in Mangaung. It's angry over a lack of service delivery as well as economic issues such as a lack of jobs. Free State Premier Ntombela is expected to meet with Mangaung residents today following that teenager's death. Now, those protests in Mangaung may have been called off in the early hours of this morning, but there were disruptions to the province's COVID-19 vaccine rollout for South Africans aged 60 and above. Let's get an update with Health MEC Montseng Tsiu, who's joining us live now from Bloemfontein. MEC, a very good afternoon to you. Grateful for your time today. Have you been able to start the vaccination program now that these protests have been called off?
Yes, but it wasn't according to our plan. We were only able to, in fact, when we noticed that the protests were intensifying on Monday, we decided not to start because we had, on Monday, the plan was to start in the Hucho Old Age Home in Mangaung and the one in Putadichaba at Tekulelo. So we only managed to vaccinate the old people in Putadichaba. Then Tuesday, we took the plan out of the Bloemfontein area, went to other parts of Mangaung, that is Vepenar and Van Stennis Res. That is where we were able to vaccinate people in those old age homes. And then today, we are in Bloemfontein at Onstens, the other old age home that is in town. We are busy giving people a vaccination there. There's no disruption at all. But before Friday, we would be at Bihucho because we're just hoping that by then there won't be any disruptions there at the township.
I'm curious about the broader plan to make up for lost time because you lost Monday and Tuesday to vaccinate at Bihucho Old Age Home in Bloemfontein. So what are you going to do to make sure that you're still able to deliver vaccinations within target?
We did the plans together with the management of Bihucho. You know, the problem with us was that going to Bihucho, we were not just going to vaccinate the residents of Bihucho. It was also the people that are coming from the township, the members of the luncheon clubs. That is what the plan was when we went to Bihucho. So we have planned that Bihucho would be vaccinated tomorrow if things are fine. If not, we'll look at Friday. If not, we are moving to other districts because all that we want is to make sure that older people are vaccinated. And then what we can do, we can transport those old age people to another place where it's safer.
And by Sunday, you had said that just over 37,000 people had registered for vaccination. Do you have numbers that are specific to the Mangaung Metro?
Not necessarily. I don't. That have been vaccinated already.
No, I mean the number of people who need to be vaccinated in Mangaung who've registered, yes.
Not necessarily for Mangaung. I have the numbers for the province that are over 50,000 that have registered already. And we know that we have to vaccinate more than 300 and 200,000 people in the Free State.
And you'd said on Sunday in the briefing with Health Minister Mkiza that number of the target for the Free State for over 60s currently is about 288,000. As things stand, you say you've got registrations in the region of 50,000. How are the public information campaigns going?
I can tell you the exact number that have registered until yesterday, because we continue registering every day. It's 50,340. So we still continue registering even today, because the plan is from Monday, all the districts should start rolling out the vaccine. Because at the moment, it's only 2 districts that are continuing to vaccinate, but we have received more vaccines, so all the districts by Monday, they would be vaccinating.
But 50,000 plus is still a very small number if your target is over 288,000. How are the public information campaigns going to make sure that you inform more people so that they do sign up, or at least help the elderly people to sign up for vaccination?
We continue using the radio or the community radio stations to give them information, the social media, and our community health care workers are out there going out telling the people how to register, except in Mangaung where we know that there's a shutdown, so they can't go out into the location for their safety. But however, in other districts, we continue with the campaigns of ensuring that they register. The other issue is that even if they are not registered yet, as they come, they walk into our vaccination sites, we are able to register them and give them vaccine. No older person that comes to our vaccination sites is turned away.
Okay, and I wanted to ask you about the shutdown itself. We saw 2 days of protests. Some of the people who took part in the shutdown were in a large gathering. They were not wearing masks. They were not keeping a social distance. The Free State is one of the provinces that have been highlighted as an area of concern for this third wave. How worried are you about the protests fueling the spread of COVID-19?
We really are worried because we have seen that as well, that people are not wearing masks. And yesterday when we were in a meeting, the Premier spoke to the leaders of the shutdown that the problem with the shutdown now is because people are not wearing masks and they are not observing any social distancing. We are really worried that at the end of that shutdown, we are going to see our numbers going up even more. The other problem that we are having is that people can't access their medications, those that are on chronic medication. That's the problem. First, when the shutdown started, we were told that essential services would not be affected. But unfortunately, we've seen people really sometimes gathering closer to the clinics, and then our employees inside the clinics, they are afraid to open that people may run into the clinics and do anything to them. And we plead with the people, the people that are leading the shutdown, that can you please consider those that are sick that need to get the health services.
Free State Health MEC Montseng Tsiu. Good to speak to you, ma'am. Thank you.